National Agency for the Control of AIDS, NACA, is urging state government to include the treatment of HIV/AIDS in their health insurance coverage. Director General of the agency, Dr. Aliyu Gambo, made the call during a capacity-building workshop for persons living with HIV/AIDS in Ilorin, Kwara State. Ibrahim Alege has details.
Discovered about 4 decades ago, the human immunodeficiency virus, HIV, attacks cells in the immune system, the body's natural defense against illness. It was first recognized in Nigeria in 1986, and its current prevalence rate stands at 1.3%. To ensure proper management of the carriers and curtail the spread of the virus, the National Agency for Control of AIDS, NACA, put together this capacity workshop for persons living with HIV/AIDS.
You find some HIV-positive persons, simply because they are positive, they just want to sit at home and expect government to now give us work, give us money, give us food, give us palliatives and things like that. It diminishes them as human beings. And those are the kind of things we want to open their eyes to.
Although antiretroviral drugs are provided free of charge for HIV patients, NACA says it will be an added advantage if people living with HIV are captured in the state health insurance scheme.
Kwara State is already leading in terms of health insurance, state health insurance program, but we still have HIV outside there. We will like to have HIV there, and that is when we will be confident that the challenges of HIV will be taken care of in the state properly.
And Kwara State was one of the first 4 states in the whole country who had that approval, and that is for HIV health services to be covered, to be incorporated under the state health insurance scheme. That approval is a working approval. What we need to do now is to work on the modality to ensure proper implementation of this.
The attendees were made to understand that HIV/AIDS is not a death sentence and that self-stigmatization kills.
HIV is not a big deal. If you have HIV and you're living with it, you can actually live a good life so long as you're on drugs, you're on medication, and you're taking care of yourself. Like, the best advice is, why will I need to discriminate myself if I'm HIV positive? It's something I have no control over.
The training is expected to strengthen the capacity of HIV-positive persons to reduce the transmission of the virus and ultimately eliminate the transmission by 2030.
The key message to the participants at this capacity training workshop is for them to in turn train others and also ensure that they do not self-stigmatize. Ibrahim Alege, TVC News.